Namaste, everyone.
Namaste.
Namaste, Namaste, Mehta sir. We are again. Yesterday we met with a few veterans who have come ahead to practice this acupressure techniques. Again, we are meeting few other veterans. I am Kallolini Patru, the coordinator of this HIRP. We shortly call it as HIRP, and SIRP means Hearing Improvement Research Program and Sight Improvement Research Program. So we are launching this HIRP and SIRP since 12 years under the umbrella of Academy of Acupressure and Acupuncture of Bangalore. The managing trustee is the Dr. H. Bhojraj, who is the ex-retired employee of ISRO. He is an engineer by profession, and he is practicing acupuncture and acupressure since last 50 years. And we have come across to him since last 12 years. I am being a student of him and pursuing this as a passion and profession, and specifically sight improvement program and hearing research program. We started specially during the COVID period on a virtual mode. We wanted to see that people were suffering during the COVID period because of the virtual platforms exposure. And sir, with divine plan and divine design and divine dream, sir came up with this idea that let's go for a virtual medium to with sight improvement program we started with. And we saw we had 120 elder people above 40 years, and we had 52 children who were under 18 years. We have few feedback videos also of those participants. Since 2020, we are continuing this program. After the sight improvement program, when we saw the improvements in all the, irrespective of the age and irrespective of the eyesight problem, sirs again came up with the idea that let's start with the hearing thing, because again in the virtual medium, putting the earplug, the earphone, or the exposure to the e-medium was increasing day by day. So, and considering the age factor also, the hearing was also a very big subject of concern for few people. So sir came up with this idea. Again, we started with 2021. Lately, with on 2021, we started this hearing improvement program also. Even irrespective of the age, irrespective of the ear issues, we had students in this program, and we saw extremely grand results. And yesterday, Bhaskar Naran sir was there, and Sundar Murthy sir, who is the trustee of this academy, they shared their experience. Today, we will listen from Nagulan sir, who is the trustee of academy. So in this journey, Ravindran sir was also one of the participant in the program, and he came up this idea that let's reach out to the veterans. We were really looking up to how to reach out to the schools and how to reach out to the residential welfare association or some MNCs programs, so that we can impart this knowledge, which is very simple, which is very effective, and there is no side effect. That's why we are launching this program on virtual medium. Seeing the improvement in all these things, we are really grateful to Ravindran sir first. Then I would like to name few veterans who come up with Ravindran sir's idea. These veterans, they have accepted the offer and they have extended their help. Without them, this platform would not have been possible of 54 people. So I would like to greet PM Mehta sir. Sir, namaste. Thank you for being there, and thank you for helping all these veterans sirs to be of a cause to see the effect of this acupressure. Mrs. Kumud Ben Mehta ma'am, the president of L&T Veteran Senior Group. Lady from the ladies group, I would like to greet Mrs. Neelam Vaishnav ma'am, and Vice President sir, Mr. PM Vaishnav sir, Secretary sir, Mr. Kirti Mistry, and Joint Secretary Mr. Navneet Batra, and without whom we could not have been in this place with our proper records, which academy is always insisting, is C. Patnaik sir. Without C. Patnaik's effort, he has done a grand work. From every participant, he has brought all the records what we were looking for to qualitatively and quantitatively we can see in the coming days that how the improvement is going on with each and every participant. And I would like to request Bhojraj sir to say something to all the veterans who have joined us in this journey. Thank you, everyone.
Thank you, Kalolini. Before I give that 5-10 minutes introductory, I request Mr. Nagulan, our trustee, to say a few words as he is going to inaugurate this class today on behalf of the academy. So, over to Mr. Nagulan Jogi. He's one of our main 72 years. He's 1 or 2 years younger to me, and he has done a wonderful job in the IT field. And now he is a freelance IT consultant. Thank you, Nagulan, please.
Thank you, Anand. Thank you, everybody. It's very nice to be among the crowd of seniors. And it's very nice to see more than just closer to 25 now join and more to join. It's very, very interesting thing to note. And when we talk about research, actually, the research has got to bring some outcome. All of us know. And the outcome, how it comes and how we analyze, it is completely dependent on the data which we generate. So that is more important. So my request to all of us is we have got a long way to go, and we are just trying to get the recognition of the government, and we are going to install this as an institution, and all the plans will depend upon what we do and what we present and what they throw as a result. So that only will prove that yes, this is a genuine thing and which we have got to go. It has already been proved, but it has got to be further proved by the data which we generate. And the form, looking at the format, it's very highly comprehensive. Some people may find it a bit, complicated and longer to do that, but still, we should understand that taking a bit of effort to fill that will give rise to lot of inferences, which will give us power to go ahead and with all our programs and all. So it's very nice to see. And now, the one thing is that we are all seniors, and the interest shown by the seniors are maybe we are aging, we are facing the problem, and we are forced to do something or other, and we do. So we are doing it under compulsion. So what I see is that we are going to take it to the younger generation, where this becomes more preventive than a cure. For us, it is mostly a cure. What we are going to prevent at this age. Okay, so only when the students and youngsters do, then really becomes an alternative therapy, which is very highly preventive. So this is my request, and our data will tell the youngsters that they have got to do it. So we should make that to become as a habit in the youngsters, and we will all try. How we try? We have got to just present what we have felt by practicing this. Thank you so much for giving me this opportunity, and take this research analysis very seriously. And whatever you do, whether it is very little or big, you record it and then you present. And that gives as a tonic to Mr. Bhojraj, who always present whatever we do and whatever the results are through the newsletter or through our meetings and all. So that will give a very good encouragement for the people who are, trying to do something for the society. We'll all try to help. Thank you so much. Take this data collection very seriously, okay? And the practice, record, and then present. Thank you so much. It is not that we are going to tell among us seniors. We all know that. Yes, I'm just addressing you. I wanted to make this point very clear. And ultimately, when the data is generated, I will give a statistical analysis. Being a statistician, I will do some official analysis and we will present it to the authorities where it makes some sense. Okay. Thank you so much. Thank you for this opportunity.
Thank you.
Good evening to all. A good start to this program.
Thank you.
I wish this research program a very, very huge success. Thank you.
Thank you.
Thank
Thank
you
you,
so
Naman,
much.
for the wonderful
Thank you so
encouragement.
much. Thank
He's
you.
one of our main trustees, not only in that technically as well as financially, he has been supporting us for quite some time. So at the outset, we'll start with our short and sweet prayer. Sarve Jana Sukhino Bhavantu. May all people be healthy and happy. That is the short and sweet prayer of our academy. I have worked in ISRO right from the day one of Aryabhatta. The Aryabhatta was the first satellite made by around 350 people and 150 engineers. Out of that, I'm one among them. And we 50 people went to USSR for launching the first satellite Aryabhatta on April 19th, 1975. That means in another 1 year, 2025, we are completing our Golden Jubilee launch, which we are planning to celebrate. Up to Chandrayaan 1, I touched each and every satellite which we made in that center. So that is our achievement. But have been working on these alternate therapies for the past 45 years and have been treating all our colleagues in my ISRO complex free without any charging anything. I treated more than thousands of people in the office itself, and I saw the cure they got with acupressure. So after that, I learned this thoroughly and got my degree in MD from Sri Lankan Open University. Last 20 years, what I have developed as an acupuncture, especially four needle method by me, is known as Dr. Bhojaraj method of acupuncture. Their book also we have released. It is all over the country as well as all over the world. This book has been given and they are finding it very useful. Then I came across one person called Professor Palnisamy, who taught me the acupressure just by giving a pressure around the eyes for 7 times and around here for 7 times and around the top portion for 7 times. It will improve the eyesight. I never believed that. Initially, I have done so much of yoga exercise and all, nothing worked. But when I started doing that, within a month, I was able to see the TV screen clearly. So the last letter, which is going down, the scrolling letters, I was able to see clearly. So then I started, removing the glasses. Within 3 months, you believe it or not, I removed my glass. The glass, whatever specs I was using, is minus 2.75. It is here with me all the time. So I'm just as a souvenir, I'm keeping it. I have not used the spectacles for the last 10 years. Night driving is slightly difficult. I agree with that. But still, I don't use the glass. That is one, this thing, my personal experience. When I came across the same technique, my colleague, Mr. Bhaskar Narayana, he has used it and he could avoid his hearing aid as well as the cataract surgery for the last 10 years. He has not gone for cataract surgery because doctors have cleared. Okay, every year they are clearing because he is a diabetic patient. He goes every year for the checkup. They say you don't require any cataract surgery now. Last 10 years I have been monitoring and we are meeting every 3 months. He says it is because of acupressure only, Bhojaraj, I am able to keep it in that condition. So that gave me confidence. We can do it for the older people also. He was 70 when it started. So all those people in that 70 also can avoid. If you have not done the cataract, you can avoid cataract. So I am also a follower of Bhaskar Narayana. Then the hearing also, within 1 week, he could throw his hearing aid. I also tried after following that. We also try all those points daily, 5 minutes we do. My hearing problem with this thing was around 7,700 for the age of 72. 72, okay, 7,000, 8,000 is quite okay. After doing this for the last 2 years, it has already gone up to 9,000. Sometimes it crosses 9,100. And 9,100 is a 60-year-old fellow only can hear, it seems. That means 55 to 60-year-old fellow, what he can hear, we at the age of 75, we can hear because of this acupressure. That is my personal experience. It varies from person to person. In our this thing, I have seen very clearly, all of you are having very good hearing power except few. We are going to concentrate on those people who are having less hearing aid, that frequency. If they have quoted around 5,000, 6,000, we are going to concentrate on them in the hearing. Otherwise, my personal this thing, I have seen the whole data. All you people are having very good hearing ability. There is no problem. There are few people who are having some problem, which we are going to concentrate individually. And most of you can get rid of the specs if possible within 1 or 2 years. But in old age, it is in the negative direction. It may take some more time. Maybe it may take 1 year or 2 years, but it will not increase. That much I can tell you 100%. So with this background, I would like to express my hearty thanks to Ravindran for initiating this process and Mr. Mehta Sahab and the executives for approving this. With this background, we will go for the first point. What we are going to introduce for the eyes, we'll start because we don't have much time. We will start with the first point. Please watch what exactly it is, and then you do it. Don't do immediately. When I keep my finger here, first of all, the nail should be trimmed thoroughly, especially the index finger nail. It should not be there. Okay, then only we allow them to touch. Okay, this particular area, this is called bladder 1 point. The bladder 1 point, you can locate it. You can just put your finger here and see there is a small ball. Okay, you can touch that ball, all of you. With specs, you can see, and then remove the specs and just touch. That particular point is called bladder 1, B1. Okay, can you touch that point, all of you? Today we can watch. Okay. Keep your eyes closed after that. And slight pressure you apply. Breathe in and release, breathe out. That's all. Simple procedure. The bladder 1 point is called bright eyes. Jing Ming, they call it. Bright eyes. It is the meeting point for 3 or 4 meridians. It improves your eyesight. Here, the next one is on the left. You can do both also, but today we'll do one by one. One on the left, press, release. The practical starts now. Just press this root here, small ball you can locate. Just press that with your index finger and release. Press, breathe in, release, breathe out. Is it clear? At least today, location of the points. That practical we will take little later. First, you understand where exactly it is. This is the point here. This is called bladder 1. So before we go for the next point, again, I want to tell you what is this acupressure. Acupressure means instead of using needles, we are using our fingers as needles. So acupuncture, acus means needle. Punctura means pricking. Instead of pricking, we are applying pressure. That's all. So just apply pressure in such a pleasurable way and release. Pressing and releasing has to be slightly pleasurable. So when you touch that point, sometimes it will be painful. That is what I'm telling you, how much pressure has to be applied, pleasurable and tolerable. When to apply this pressure? It is especially when your stomach is empty, is advised. Maybe in early morning 6 to 8 is ideal. Evening 6 to 8 is ideal. Otherwise, 1 hour after lunch, you can do that. Absolutely no problem. Who are all the people who can practice? That is the next question comes. Anybody can practice. Absolutely no problem. So 10 years onwards, we just fix that limit. 10 years child can understand. Up to 100 years, absolutely no problem. We can do all these points. Now, the bladder 2 point. Bladder 2 point is just the start of the eyebrow. The eyebrow is there. This is the point. You just see eyebrow. You look at your screen. Where exactly is your point? Here, see here is the point. Yeah, correct. All of you. Press, release. While pressing, breathe in. While releasing, breathe out. Press, breathe in, release, 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 breathe out. So this point improves the eyesight. Hearing also releases blocked nose. If the blocked nose is there, this point will release. And it reduces watering of the eyes. If they have any watering in the eyes, it will reduce. It reduces redness of the eyes. Swelling and the pain in the eyes also will be reduced. Reduces twitching of the eyelids. Some people may have twitching of the eyelids. It reduces glaucoma. Glaucoma reduction point is this. The glaucoma is basically that eye pressure will be more. So that can be reduced by this bladder point. This is the second point. We are going to give you only 7 points. The third point, you can do it on the left also, absolutely no problem. Use your left hand, press, release, press, breathe in, release, breathe out. Press, breathe in, release, breathe out. Press, release, breathe out. Press, breathe in, release, breathe out. Like that 3-4 times I'm doing. Colonel will make you do for 7 times. Next one is your middle point. That's called extra point. MHN6 they call. MHN6 is called, it improves the eyesight. Here you see that there is a small dip. If you consider that small dip, just press that dip, breathe in and breathe out. While pressing, breathe in, releasing, breathe out. Pressing, breathe in, releasing, breathe out. You could identify that point. Is there anyone who is not able to identify? Please raise your hand. Here, see, you just come here, there is a small dip. Center of the eyebrow, center of the eyebrow. You press this is an extra point, improves eyesight, cures twitching of the eyelids, reduces cloudiness in the cornea, reduces redness, any swelling or pain in the eyes with these points. It's a wonderful point. These 7 points are very, very important points for our eyes. Is it clear? Then we go to the end of the eyebrow. This point is called triple warmer 23, TW23, end of the eyebrow. You just touch here. This cures the eye and ear problems. Any ear problem also this point will cure. Useful for headache. Any headache is there, this point is very useful. Cures redness and pain in the eyes. Any redness or pain in the eyes, it will cure. Reduce blurring of vision. Blurred vision will get cured. Cures twitching of the eyelids. Twitching of the eyelids it cures. Even toothache it cures. And facial paralysis also, this is an important point. Triple warmer 23. So the end of the eyebrow, TW23. Just go to the left and press and release. While pressing, breathe in. While releasing, breathe out. While pressing, breathe in. While releasing, breathe out. Like that, 3 to 4 times now. 7 times you are going to make you do. Then comes your 5th one is your gallbladder 1. The gallbladder 1, just the center of the eye you can see. End of this here. You see here? It cures redness of the eyes and pain in the eyes. Any pain in the eyes, it will get cured. This is called gallbladder 1. Improves vision, reduces eye watering, cures deviation of the eye and mouth. If there is any problem with the muscular system, this gallbladder 1 will help you. Okay. Similarly, go to the other side to identify that point. See, end of the eyebrow, just come down, straight line. If you draw a line, it is on the center. Okay. Press, breathe in, release, breathe out. 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 Then comes the last 2 points, very, very important points called stomach 1. Where it comes, you just see, there is the orbit, the bone, the small crater is there. Just and straight line, if you draw in the center of the eyeball, you get a small crater there. If you just move, you will get that crater. In that crater, you have to just press and release. While press, breathing, release. This is very, very important point. One at a time, please you do so that you locate it. Both we will do later. One at a time. One at a time. Mallikarjunachar. One at a time. Press, breathing, release. Today, identification only. Tomorrow onwards, practice. Okay, go to the right. You locate that small crater there. Yeah? Are you able to see that crater? Exactly in the center. If you just see the center line you draw, you get that small crater there. Press, breathe in, release, breathe out. 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 Any one of these points, if you have any pain, just register that pain in your mind. Maybe another 2 days, the pain will come down. Register that pain. So here when I do, there is pain. Register it. Then tomorrow we'll see how it is. Day after tomorrow mostly. So now the last point, stomach 2. If you draw a line, center line, this one, you just see just above. You will be able to get that on the center point of it. You just look at yourself in the screen. Your eyes, yeah, you center, you just watch me where exactly it is. Tomorrow we'll correct. I think Prakash Prabhu is not correct. Yeah, slightly, yeah, it has to be like this. You see here? We'll correct you tomorrow. Okay, don't worry. We'll practice this. Yeah, that is also Dugal Sabha, yours is also not correct. Slightly, you have to come near, close to the nose. Close to the nose. One finger you take, you will get that. Yeah, there above that, this particular one bone is there, against that bone you have to press. Press, breathe in, release, breathe out. 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 So it reduces redness and pain in the eyes, clears superficial visual obstruction, they say. Improves visual dizziness. If there is any dizziness, it will improve. Improves itching of the eyes. Reduces excessive lacrimination. That means the tear glands, overactive. It will bring it to normal. Cures deviation of the eyes. This particular point is very helpful. So this is the introduction for all those 7 points. With this, how to relax after that? You just rub your palms, create heat in your palm, and close your eyes like cupped palm. See, cup, and close your eyes. Look at the darkness. The darkness you are able to see inside, pitch dark. Your eyes are open because the brain needs darkness. Darkness charges the brain. Just look at the darkness for a few seconds. It relaxes, the eyes are getting totally relaxed. And then open the eyes. Just look at the tips of the fingers. And then look at your chart. That's all. The chart you should have at 6 feet distance already fixed. Without chart, you will not be able to see any change. So the chart is there, 6 feet distance. It should be fixed, or any small letter or something like that, which you can observe. You can have it. It will become very clear. So this is what you call the first set. The second set is blinking, as I told you. Now you just see here how to do that eye blinking exercise. Very simple. Just 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 24, 25, 26, 27, 28, 29, 30. That's all. Rub your palms. Close your eyes. Look at the darkness. And slowly look at the tips of the fingers and look at your chart. So that is the second exercise. Now we'll go for the third exercise. It's very simple exercise only, squeezing of the eyeballs. Eyeballs, there are six muscles rather. They are in the inside. They are controlling all those things. They have become tight. That's why that fixed power is there. Now it makes it relaxed. You relax those muscles, the stress is removed, then it will accommodate automatically. I have seen that difference after doing for 3 months. You can also see the difference on your eye power. Sometimes, it reduces, you have to change the glass also. So that's how to do that one. Squeeze means just squeeze the eyeballs slowly and release. Squeeze and release. Squeeze and release. Squeeze and release. Squeeze and release. Look at the darkness. Slowly open the eyes. Look at the tips of the fingers and look at the chart. This is the set. What we are going to practice now. Another 10 minutes on eyes, because hearing, I have seen all you people are very good. In the eyes, some people are having problem. We will practice today for 10 minutes. Kololni, is it okay now? Any doubt in this particular one? Everything is clear, isn't it? Yes. Who has got doubt? Jayanti, yes. You unmute, man? Yeah. Unmute. You're muted. I think Kalolini, you have to unmute for all. Unmute. Yeah, Jayanti.
So when you are rubbing your palms,
Yeah.
bit like this on the eyes, eyes should be open or closed.
Yes, eyes should be open. After in it is closed condition, after that it should be open. You should see the darkness.
So inside the
eyes open. Eyes open. Eyes
Okay.
open. Yeah, okay. Right?
Thank you.
Any other doubt? It's very simple. If I locate the point, there is nothing else. That's one class itself, you will be through.
Mehta sir, unmute yourself.
Yeah. Somebody is.
Mehta sir wants to ask.
Yeah, please.
Mute.
I want to ask one question.
Yes.
The pressure to be applied for one at a time or both together?
No. I just for the your identification only, I've done one side and then another side. When you are doing, we will do both sides. You are practical now. 10 minutes we are going to do on both sides. Okay.
When you are doing both sides together.
Both sides. Yeah. We'll be doing on both sides for eyes. Okay. What else? Patnaik sir, when it is okay, practical, whatever the points are very clear now.
Only you mentioned that every activity will be repeated 7 times, right?
Yes. Only for the demonstration I did 3 times. Kalolini is take this 10 minutes class today.
The only place where I'm finding little difficult to locate is the center of the eyebrow. I think the point number 4.
Yeah.
Is there a depression kind of a thing, or
a small depression you can get? See here, you just
okay.
move your finger. There was some small depression you will get.
Okay.
You see here,
Okay.
I'm getting here. All of you can tell other people, in the eyebrow you come, there is a small, and then it goes like this.
Okay.
Yeah, that's very simple. Okay, we can get that.
Yeah.
It is below the eyebrow.
Otherwise, it's center you go.
No, I know. But is it on the eyebrow or below the eyebrow?
On the eyebrow.
On the eyebrow. Okay. Okay.
Eyebrow only we get.
Okay.
Very clear, right?
Sir, excuse me.
Yes.
Hello.
Aparna. Yes, Aparna.
Yeah. For dry eyes, what has to be done?
And lacrimal glands, you go for this point. That's all. Triple warmer 23. Just keep on pressing. Day after tomorrow, your dry eyes will become normal. Just you try. Yeah. This is triple warmer 23. I told you. Such a wonderful system because the lacrimal glands are located here. Triple warmer 23. You activate that. Automatically, it will start secreting. Otherwise, you have to take drops. Those who are taking drops, gradually reduce. Don't stop immediately. Okay.
Doctor, what about the age-related macular degeneration?
Yeah. Slowly and steadily, we will be able to see the difference. There are people who have, we have got so many other solutions also. We will take care of such people little later, maybe after 1 or 2 classes. Third class, I will look into that because the data will be available by that time. Then I will be concentrating on those people who have some problem. Okay. Nice.
One more question.
Yes.
The cataract operation, if it is done, same exercise to be repeated or same exercise applies?
Yes, 6 months. We only 6 months. You are not supposed to do any of these exercises. After
Okay.
6 months of this cataract, you do it. Your new eye, eyes are new. Everything, they have replaced with but the lens is new. That's all. Otherwise, all other cells are getting renewed. Every day you are a new person. The cells are getting renewed every day, inside, outside, everywhere. So you have to be on your toes till the end. Okay.
Fine, thank you.
In a one day you have to do once only, na? Or
If
2
you
times
do,
a day.
if you do twice, ideal. So those people who have problem, they have to do twice. Those people who don't have any problem, once a day is enough. Okay. So even though we are all right, every day we are doing it without any problem. So daily we have to do 10 minutes. Then only it's like eating food. Once you get into
Okay.
this
Right.
system, we have to do
Yeah.
10 minutes every day. Okay. With this, now go for the practicals. Eyes will complete. In the years, I will introduce those points only today. Yes, Kalolni, it is yours now.
One point, sir.
Yes.
The advantage of pressing different points, you read out something.
Yeah.
Is it possible to get those details?
100%. It is already
Yeah.
uploaded. It's already uploaded in my newsletter.
Oh, is it?
Once
Okay,
again,
okay.
I will upload. Please read
Okay,
it again.
okay,
I'm
okay,
reading
okay,
from that on.
okay.
Everything, because we are making everything clear to everyone. It
All
is
right. Thank you.
If doctor, the points in a diagram on a face, do you have any graphics of something of that kind which we can use?
Yeah, everything is there. Kalolini has made it very simple. I think you have not seen all the things. She has sent already everything. You have to see that WhatsApp group. Please, we will send it. Don't worry about it. Now we'll go for the practicals. Okay?
Yeah, put bindis were there.
Yeah. Bindis were there. Yeah. Very nice. Anyway, now we will go for the practicals. Every one of us will look at the chart, see which line you can read clearly. And after the practical, we'll see whether it is really one line improvement is there or not. I have seen 1 or 2 lines improvement. Yes, Kalolni, 10 minutes only.
Yes, sir. We will practice the eyes, sir, for the eyes.
Yeah, eyes only. You have
Okay.
to practical.
Before that, I want to request Jayanti ma'am to raise her. Jayanti ma'am, can you raise the mobile or whatever the medium you are with?
Your face
We can
should
see
be
you.
visible. Face should
Keep
be
your
visible. Now,
keep your back straight.
those who
All
are
of you.
wearing specs, please remove your specs so that in the end only you are going to open the eyes. Now eyes you not required. Whatever she tells, you will be able to do that. Okay, right. Remove your eyes. Remove your specs.
I will tell the point. You are familiar now. You are familiar with the points. I will say inner corner of the eyes or the starting point of the eyebrow, mid portion of the eyebrow, end portion of the eyebrow. So you can feel it and touch it and press it. So no need to wear the specs. Okay. If there will be any difficulty to understand, then you can wear it. Let's start. Please keep your face close to the camera so that we can see you where you are pressing. That is more important. Accurately we have to do. Okay. We can use our index finger or middle finger, whichever finger you are comfortable with.
Index.
Keep your neck straight. Don't bend your neck, ma'am. Jayanti ma'am especially. Mohan Kumar sir. Keep your neck straight. What you can do is from the next class, I want to just show you. I am sitting on a table. Okay. I am resting my elbow here. Okay. Because it will be 10 minutes class. Your hand should not get tired. So take rest of the, take support of the table. If you have a study table, dining table, whichever table you have, sit on that. Your visibility will be proper and you can start pressing the points. Okay, let's start. We will, please follow my instruction, then you will do it. Press, inhale. Simultaneously, we will inhale. Keep the pressure there, pleasurable pressure. Release your breath, release your finger. Just release then and there only. Inhale, press. Give a pleasurable pressure. मीठी सी दर्द देना है. Exhale, release the finger. 7 times we will press on each point. Inhale, press. Release. Release your finger, exhale. Keep your eyes closed. I will tell 7 times we will do. Please don't open your eyes. Inhale, press. Release, exhale. While you are pressing there, you can feel a little mustard kind of small bump is there. Small tiny bump is there on the corner of your eyes. Okay? With your tip, you should feel it. That is the accurate point. Okay? You can move little here and there if you are not able to feel. It is in the corner of the eyes only. Where the white discharge comes out, it is on the outer section we are pressing. So inhale, press. JRT sir, please do with us so that you will be practicing and you will be comfortable. Inhale, press, release, exhale. Keep your neck straight. Don't bend your neck. Parasar sir. Inhale, press, release, exhale. Farah ma'am, keep your eyes closed. Once more. Inhale, press, release, exhale. Relax. Now we will go to the next point, second point. Everyone has an eyebrow. Now we will go to the starting point of the eyebrow, where your eyebrow hairline is starting. That is the second point. Okay. So everyone has a different eyebrow starting from a different place. Satish sir, keep your neck straight, please. We will use our again fingertip. Close your rest of the fingers so that we can see where you are pressing. Otherwise, your other fingers are hiding your point. Yes. Please keep your, see me, I am folding all my rest fingers. Okay, very good. Keep your neck straight. Yes, sir. Siva sir. Don't move, bend your neck ever. Press, inhale, release, exhale. Feel the pressure. Feel the bearable pressure. Feel the pleasurable pressure. You are giving a pleasurable pressure. You must feel it that you are pressing yourself. Second time we will press. Press, inhale, release, exhale. Press, inhale, release, exhale. Press, inhale. Feel the pleasurable pressure, then release and exhale. Keep your eyes closed. Listen to the instructions. Press, inhale, release, exhale. Press, inhale. We are not going to squeeze our skin. We are not going to push or pull our skin. Exactly perpendicularly, we are on the point. Because of, yes, sir.
Please do only 7 times. Date and explanation, you can
Yes,
give
sir.
it. Please
Okay.
do only 7 times because people are doing for 10 times, 15 times like that. So you go for only pressing and releasing. Yeah.
Yes, sir.
So, third point.
Yes. We will go to the third point. Third point, sir, has said that there is a depression. What you can see is, if you are not able to find it, everybody has different eyebrow length. The mid section of your eyebrow is the point. Everybody has different eyebrow length. So go to the
Please go ahead
hairline.
with pressing and releasing. Explanation you don't give.
Okay. Let's go to the midpoint of the eyebrow. Press, inhale, release, exhale. We will not pull our or push our eyebrow. Exactly on the hairline, in the midsection, we are pressing. Press, inhale, release, exhale. Third time. Press, inhale, release, exhale. Fourth time. Press, feel a pleasurable pressure. Release, exhale. Sunita ma'am, go to your midsection of your eyebrow. Even Dugal sir. Midsection of your eyebrow. Yes, sir. Satish sir, please keep your neck straight. Go to the midsection of your eyebrow and fold all of your rest fingers. I cannot see your point. Press, inhale, release, exhale. Nobody's eyebrow will lift up. Press, inhale, release, exhale. दुगल सर थोड़ा सा बीच में आ जाइए, आईब्रो का बीच में आ जाइए. राइट हैंड आपका मूव टुवर्ड्स द. See yourself in the camera and see where is your midsection of your eyebrow. That is also one more guidance to check yourself. Press, inhale, release, exhale. Sixth time. Press, inhale, release, exhale. Seventh time. Press, inhale, release, exhale. We will go to the fourth point, end portion of your eyebrow, where your hairline of eyebrow is ending. That is the fourth point. Feel your eyebrow, go to the end portion of the eyebrow. Otherwise, if you are not able to feel or the eyelashes, eyebrow is, the hairline has receded, so you can see yourself, the structure of your eyebrow, and you can go to the end portion. Okay, now we will again press, inhale, release, exhale. Very relaxed inhalation. It's not a very forceful inhalation and exhalation. Very smooth activity of breathing in and out. Inhale, press, release, exhale. दुगल सर सही है, करिए. Please do. Inhale, press, release, exhale. Everyone is on the right point. Please press, inhale, release, exhale. Press, inhale, feel the pain. Release, exhale. Press, inhale, release, exhale. Press, inhale, release, exhale. Now we will go to the next point. Next point is where we used to draw the kajal line, the last pointer. If you'll come down from the last portion of the eyebrow, you will find this straight line where we used to draw the kajal when you were young. Yes, sir. The point will fall on the bony structure only. You will feel a bone while you are pressing. Okay, it is on the bony structure and in a straight line of the eye if you will close your eye. Let's press. Close your eye. Keep your neck straight. Press. Inhale. Release. Exhale. Give a pleasurable pressure on this location. And these are the little slippery points. So you have to be little firm while pressing the point. Press. Inhale. Release. Exhale. Dugal sir and Mrs. Dugal ma'am, just see me. Go straight from, if you close your eyes, go straight to the outer corner of the eye. Okay. Press, inhale, release, exhale. Press, inhale, release, exhale. Press, inhale, release, exhale. Release means relaxing your finger pressure. Press, inhale, release, exhale. Press, inhale, release, exhale. Press, inhale, release, exhale. We'll go to the next point. If you'll see straight from the pupil, if you'll draw a straight line, come close to your lower eyelid, and it is in a straight line of the pupil, and it is below the lower eyelid, very close to the lower eyelid. So you have to be very, very careful while pressing. So keep your eyes closed so that your finger should not move here and there, and you should not hurt yourself. So if you are pressing it, your eyeball will little pop up, little. There will be little impression like that. Yes, Patnaik sir. Like that only. Press, inhale, release, exhale. I'm looking at everyone, so I'm opening my eyes. So you all please keep your eyes closed. Press, inhale, release, exhale. Press, inhale, release, exhale. Press, inhale, release, exhale. First 2 days, it will take little time. After that, it will be hardly 5 to 7 minutes. Once you are familiar with the points, how to do it, exact location, then it will not take more time. Press, inhale, release, exhale. One more time, press, inhale, release, exhale. Okay. Now we will go to the last point. On the cheekbone. Again, it is in a straight line of the pupil. If you look straight, draw an imaginary straight line and come to the cheekbone. Your cheekbone, pointed part of the cheekbone, which is up, a little lifted up. Here I am just a 1 finger away from the side of the nostril. See, I have kept my 2 fingers. The middle finger is measuring and the index finger point is the point. Okay, keeping my fingers like this. Press on the index finger tip. This is on the bone. Press, inhale, release, exhale. Press, inhale. Nikhil sir, you have to correct yourself. Please see me little. Pin my video. See myself, sir, first. Press, inhale, release, exhale. Dugal sir, आपका गलत हो रहा है. Ma'am and sir, you have to improve. Please see me once. You can see pin Bhojraj sir's video also. If you want to see us closely and practice with us from next class onwards, you can pin one of our video, either sir or me, so that you can practice with us properly. Professor sir, you are doing right. But you have to keep little straight. You have to sit.
Mr. Dugal, you go like this. You just put it. Here, you see? Yes.
Press, inhale.
From here, you go like this. Touch. Yeah. I will do okay. Slightly down. This side, this side. See?
Mrs. Mohan Kumar ma'am. Ma'am, you have to shift your finger little away. 1 finger away from the nostrils.
Just,
both side.
Just 1 finger away. Get that part.
Thanks, sir, doing perfectly. Ravindranath sir, can you see me? This is the cheek, na, we have. There is the bone. We have the cheekbone. The lower side of the bone. We are pressing as if I am lifting my bone up.
Yeah, please finish.
There is no problem.
Finish
Don't
that.
worry.
We'll ask. Finish that. We'll ask them to. Yeah.
Right.
You finish. So that. Rub.
So please finish your pressing. Yes, now we will rub our palm. We must feel the warmth in the palm. Till that time, we will little rub. Sometimes due to the weather, we may not feel the warmth. So we will make a cup. We will create a gap between my eyes and my palm, so that I can open my eyes inside the palm covering and adjust your palm such a way that no external light is passing through the finger gaps or palm gaps. You are completely in a dark zone and you are opening your eyes in the dark. And this is the most healing time. Adjust your palm. No single pinch of light should pass through your finger gaps. Keep your eyes open. Don't close your eyes inside it. Be there. Feel the warmth of the palm, what you generated by rubbing it. And after being in such a state of darkness, take out your palm. Look at the fingertips. The way we pray, the Muslims pray. Huh? So we are looking at the fingertips. So whatever energy we captured, we are releasing through our fingertips. Again, it is going inside the system. Sir will explain about that. So we are looking at the fingertips. So after that, what we will do, we will sit every day on a fixed area. We should have some bookshelf or some calendar or something in front of us where it is something is written in front of me, which is 6 feet away. Like you can see this bookshelf behind me. If I would have sit other side, I would have looked at the bookshelf so that I can see one book, read one book, how the visibility is. Every time you will practice, you after the releasing of the palm, you see to the calendar or book or anything, whatever is there, which is readable or visible to you. See the clarity.
No problem. See, they can use the eye chart also because the time is up already. 5 minutes I need for that year also introduction because we will do that introduction. See, a lot of mistakes are being made. We are observing. We will correct it because each point is very, very important. If you locate the point, you will get the results. If you don't locate the point, result will not be there. You press anywhere here, it will not work that effectively. So we have to, that somebody was making that mistake of pressing here, it will not work. This is the point. You just see 1 inch straight down. That we will correct it tomorrow. So today, your another few points we should know for the ears. For the ears, I have seen almost all are having very good hearing. This thing up to 7,000, 8,000, 9,000, 10,000. Some people even 11,000, 12,000 also. The hertz they can listen. That means they are very good. Those people below 6,000 only we are going to concentrate more. So that we will see from our whatever data you people have given. Maybe day after tomorrow we'll identify those people and we will take care of them, especially after before and after. Okay, the points. Now we should know the points. One is this: hearing loss occurs because of the aging factor. You know very well the loud noises in the city creates more problem. Hereditary also one of the reasons. Head injury, something is there for the children or with this thing that would have created problem for the ears. Infection, frequent infection, the ear also is a problem. Nasal related problems also will create problem in the ear. Drug reaction, those people are taking regular medication also, they may get into problem. Hypertension is one of the primary reasons for the loss of hearing, they say. So we have to go for a first point. We can come out of that by, this is called triple warmer 21. You just open the mouth, you get an opening. See, this is tragus. The tragus, topmost of the tragus, if you touch and open the jaw, the mandible, where it touches, that is the point. Are you able to locate? Please locate today. Yeah, that's all. First point. Press, breathe in, release, breathe out. That's all. Same technique we are going to use. The second point is middle of the tragus. Middle of the tragus, where the topmost point is there, you know. That point, if you just keep your hand like that, there is a bone. You open the bone, you will touch top of the bone. See, the mandible you open, you will touch the topmost point of the bone. That's it. That press here, release. Press, release. Like same technique we are going to use in our practical classes. The third point is bottom of this. Bottom, this 3 location here. This is called gallbladder 2. It reduces swelling in the ear and redness in the ear, reduces pain and pus and everything it will cure. Just press here and release. Here also just open. You will get the middle of the bone. the bone you will touch here. Okay, 3 points. The fourth point at the back of the earlobe. Back of the earlobe, it's called triple warmer 17. The back of the earlobe, there is a small cavity type of thing. You can see that. This is very useful for giddiness. Anybody getting giddiness, vertigo, this is very useful, especially people like us above 70, 75. As a preventive this thing, we can just press the back of the ear 7 times or 14 times, and you will get the preventive health care for that giddiness or vertigo type of problems. These are all the 4 points. Similarly, you have 1, 2, 3, and the 4th point. So this point we are going to press and release 7 times like what we did for the eyes. And extra points, what we have is here at just 2 fingers above you get the point. 8, 9, 10, 11, 12. The gallbladder 8, 9, 10, 11, 12. Like that, you are going to press and release. While pressing, we are breathing in. Releasing, we are breathing out. Like this, we will be doing it. And then the insertion of the fingers, that is the important thing which Kalolini will introduce. You have to use these 2 fingers inside the ear and open like that 3 times. I think you can introduce now only that particular one. With that, we will be closing. Already we have overshot 5 minutes because we can't cross 7 o'clock. Yeah.
So what we will do, we will insert our little finger inside the
Careful.
ear hole.
No nail should be there.
There should not be no nails. You must have trimmed your nails before the class. So we will block our ear so that we are not going to hear the external sound. We are restricting our ear to hear the external sound. Not even you cannot hear our sound also. Okay? Even the surrounding sound of your house right now. So we will block our ear and open our jaw little wider. Okay? So 3 times we will do. Block, open your jaw. 10 counts we will be there. Again we will release the finger. Again insert it. Then and there. Open your jaw. 3 times we will do. Just see me once, then we all can. We all together we will practice. Blocking my ear. I can't hear you. You can name my name also. So I will be opening my jaw and counting 10 in my mind. Till that time, I'm opening my jaw widely. Relaxing my ear, then and there. Again, I am inserting, blocking my ear. I finished my 10 count, released my finger. Again, I am blocking. Understood? Let's do it together.
Good.
Relax. Relax.
Very good, very good. Everybody is doing correctly. This
Perfect.
So this particular one alone is sufficient to improve your hearing frequency. You can see today, you can check every day, you can check 6 feet distance that what you got the number, what you can see the line, and this frequency you switch on and see whether you can listen slightly better. 100 or 200 hertz will improve every day. So with this, we are going to close because time we already overshot. We don't want to take much of your time. 7 minutes to 8 means 7 to 8 we should complete. Your questions will be answered day after tomorrow. Okay.
Sir, we will request Siva sir to wind up this.
Yeah, Shivu,
Just one question.
Yes, madam.
Sometimes should be using different device, no? Then only you'll be able to see the clear picture, right?
Same device, whatever we have sent that application, only you can use.
Okay, fine. Thank you.
Same that we have got one application we have sent, keep that as a standard. How many frequency, how much you can listen. Okay.
Okay.
That's all. That's the main this thing what we are going to monitor. Okay. 5,000, 6,000, 7,000, what we have put. Same thing, you know.
Thank you.
Thank you, ma'am. Anybody else? Question? Otherwise, Patnaik sir can close it.
Yeah, I think there'll be certainly some questions will come. And I would request Mrs. Kalolini Patro, she's available on telephone. On a one-to-one basis, they can ask questions and she can clarify. Apart from what she's clarifying inside the classroom, I mean, inside, in front of the screen, any further questions can be clarified. And number two, as Dr. Bojraj has mentioned, that I think we should have that particular eye chart close to the screen at a distance of 6 feet, so that given a chance, we should be able to see it after the class is over. Or is it all right that we have it at the standard place in another room? We can check ourselves after the class is over.
Both are okay. No problem. Absolutely.
So-
I just have it here. You just see that wherever it is.
Yeah, you have it in a convenient place.
It will be better. Otherwise, you have to go there and check.
All right. So we'll try and put it in the same room itself
Yeah,
and get the thing done. And I think all of us are, I think, 100% enthusiastic. There's no doubt about it. And course correction is required because we are doing for the first time. And we are doing in a virtual mode. I think Kalolini is pointing out a couple of people and we are sort of, game for that. Once we correct it and the spots are identified, then it's a question of practice.
Correct.
So I think with this, we will come with a little more juice next time.
Wonderful. Okay.
I have one question. Can we directly contact Kalolini for any clarifications we need?
Absolutely no problem. You can contact her, contact me also. Anyway, through Patnaik, you can always contact both of us. No problem. So we'll be available for next 1 month, not only 1 week. Next 3 months also we are available. No problem.
We'll do that.
Thank you. Thank you.
Thank you
Thank
very
you.
much. Thank you.
Thank you.
Thank you. Namaste
Thank
to
you so
everyone.
much.
Thank you very much. Thank you very much. Thank you very much.
Kalolini, you can wait for some time.
Yes, sir, I will.
Well, and Patnaik also can stay for some time till.
Thank you, Ravindran sir.
Yeah.
Thank you for Siva sir.
Thank you. Thank you.
Thank you.
Thank you, ma'am. Namaste.
Hello, if you can.
Thank you, sir.
Thank you everybody. Ravindran also can stay for a minute or so, if he is available. I think you are muted, Patnaik. You are muted.